Welcome to OET Medical Online. So, good morning, good afternoon, good evening, wherever you may be. This is the final part in our listening video set. This is Listening Part C. For the introduction video, you'll know that Part C has two parts, which consist of two longer listening extracts and 6 multiple choice questions per extract. So there are 12 questions in total. So what we're going to do now is we're going to continue with our walkthrough of the exam part. Part C represents the most difficult part of the test for many test takers because of the length of the two extracts. A lot more concentration is required, as you cannot afford to get stuck at any point. If you do, you could have problems catching up with the text audio again. The format for the questions is multiple choice questions with A, B or C choices. The main skill required in this part of the exam is the skill of sectioning. What that means is when you move from one section to another, or one question to another effectively, you have to know when to do this. And if you can't do this, I'll rephrase that. If you are not able to do this effectively, then you will lose track of where you are and it will be more difficult for you to catch up. So as you're listening and writing your answers down, you also have to focus on listening to the track, working out where the changes are when they move on to a new question, and obviously writing your answers down or making notes of your answers. Without this skill, it is almost impossible to keep track of where you are when following the audio. And as a note, I will tell you from personal experience that I found it tricky when I was doing my training for this. Even though I am a teacher, I found it a little bit challenging. So you guys will find it more challenging, but it's nothing that practice will not overcome. So, one of the first things we'll do is look at how to section the conversation into segments. Throughout the conversation, dialogue, there will be transitions which indicate changes. Things to listen out for when trying to spot transitions are changes in tone of voice, natural conclusion vocabulary, words and expressions which signal the transition or end of a subsection, and of course the beginning of a new subsection. The vocabulary related to the section, if or when it changes. You can be sure that you're on a new section when the vocabulary changes, of course. And then finally we have questions. If this is a conversation rather than a monologue, the interviewer will chime in at certain points. So the speaker will talk about that current issue or topic, and when he or she is finished talking, the interviewer will move on to the next question or the next point. That is an obvious time to tell you that it's going to change, because there will be a new question or a new topic. So, here is part of a script from one conversation. This is a practice exam, so you may have come across this before. So we're going to use this. Now we're also going to look at how we answer the questions. Rather than have a separate video for that, we're going to encompass both things. So, this is an interview with a Dr. Jack Robson, a cardiologist and Chagas disease specialist in America. Now, the interviewer is talking, so we know it's going to be an interview. So therefore, there'll be two people speaking. So there'll be breaks between the interviewer speaking and the guest speaking. So that's that's the first thing we can see, is that the interviewer will introduce each section. So when it changes from the interviewee to the interviewer, you know, or you can be pretty sure that they're going to move on to a new topic. So this is Dr. Robson. This is about Chagas, and this is the first question. What is Chagas disease, and why is it referred to as a neglected disease? This is one of the questions. So at the bottom, as you can see, you have three choices. And the way that you should look for the answers to these is look at the highlighted points in the question. Neglected disease. That's what we're talking about. Now, you won't see the word neglected in the text. Occasionally you may see the same word, but most of the time you will see some kind of paraphrased example. Okay, so why is it referred to as a neglected disease? We have, because of the social group it affects, because people don't realize they're infected, and its impact, or severe impact, is relatively low. Now, to save time, I've highlighted in blue and green the things that are relevant to this answer. People don't realize that they've been bitten, and during the initial phase of the infection, the symptoms are normally mild or absent. 70% of those infected never develop complications. For the other 30%, the disease tends to remain silent for a long time, often 30 years. Now, that doesn't talk about it being neglected. It just describes the disease being in people and being dormant for many years. So it's not neglected. So the next thing we can look at is about 7 million people worldwide are thought to have Chagas. Well, it's talking about nothing. Relatively small numbers of cases. Okay, it could refer to that. About 7 million people. The population of the world is a few billion, so we're talking about a very small thing, but it's not referring to the fact that it's neglected. What do we mean by neglected? It means it's not paid attention to. People don't really do much about it, or they don't care. Okay, so in green we found a word, indifference. Now, indifference is a a synonym of neglected. If you're indifferent to something, basically you don't care much about it. If you neglect something, in the same vein, you don't care about it. So we can look at this word, because this is the paraphrase of neglected. So let's read this. It says, this indifference, or we could even say this neglect, we could actually replace one word for the other word. This indifference is largely down to it being primarily a disease of marginalized communities in Latin America, where it's endemic. You need resources to force significant action. So we could say that it's a neglected disease because of the social group it affects. Marginalized community. A community is a social group of people. And there is no other reference to neglected in the other two choices. Patients don't realise they're affected. That has nothing to do with neglect. Severe impacts, relatively small numbers, has nothing to do with neglect. But social groups it affects, that's neglect. It's a social group that is not important. That's the way it could be viewed, even though we wouldn't view it that way, but that's the way it could be viewed. They're not important, so we neglect them. So this is the way you have to look at each question. It's tricky and you have to do a lot of practice, so don't be put off by this question and thinking, oh my goodness, it's difficult. It takes time, it takes practice. Okay, so here is just a review of what we've just looked at. For this example, we're going to use a script so we can see where the information is that we're listening for. And of course, you can stop the video at any time and download the script. The script is in the link below. So, the script says 3 things which correlate to the 3 choices. Because of the social groups it affects, primarily a disease of marginalized communities in Latin America. People don't realize they've been bitten and symptoms are mild or absent. Patients don't realize they've been affected. And the final one, because its impact is relatively small, 70% of those infected never develop complications. There's 7 million worldwide compared to a world population of 3.7 billion. So, very small. So, download the script, read through the script and follow it. Doesn't matter how many times you do it, just practice it. So here we're looking for something which refers to neglect, which I mentioned before. The only reference that fits the bill is indifference, which I've previously explained. Here is an explanation of it, so you could read it again. And the answer is going to be A, because the other 2 do not fit, as we've also checked. The other 2 answers have nothing to do with neglect or indifference. So the next thing we're going to do is listen for the transition to the next question. So here, the interviewer will take over and she'll begin talking about another question. Dr. Robson says that concerns over Chagas in the USA are a result of. This is a completely different topic within the overall topic. Things to listen for. Summary words, words that tell you something is finishing. Change of speaker, of course, and a question. A question means we're going on to a different topic. At the end of the first question, the interviewee basically sums up why this disease receives little or no attention. It says you need resources to force significant action. This kind of tells us that there's no more that can be done. So it's telling us there's no more to be said. Yes, nothing else can be done without resources, which is money, basically. So, as it mentions here, this in effect tells us that without money, nothing is going to be done. So, no more to be said on this topic. So, it's a kind of end of discussion sentence. The strongest indicator of all is that the interviewer will resume talking, which usually tells us that another question will be following. So again, these are the things you should practice. Practice regularly, practice different aspects of the interview. And the things that you're strong at, obviously, focus less on. The things that you're weaker at, focus more on. So let's move on to the next question. But for this, we're going to skip to question 33. A patient called Marisol recently asked Dr. Robson to test her for Chagas because. So the clues here from the question are Marisol, test for Chagas, because these are the main keywords we hear. Names cannot be substituted. So Marisol is someone's name. We could say a lady. A lady is tested. Marisol is a lady's name. We could say a lady, but usually they would say the name of the patient. Test for Chagas could be something similar, like was tested or had a test. But test is a word that we wouldn't really need to change. When someone's talking, they don't need to change the word test. So you would probably hear the word test. And Chagas, of course, we can't change. So the transition here is the interviewer's question. This tells us to move forward. And for the benefit of our listeners, can you describe an individual case? So the interviewer is asking him to describe a case. So this is where you start listening, because you know the interviewee is going to start talking again. So here are the choices. She was worried about the health of any children she might give birth to. I've highlighted what I call my keywords in blue. Yours could be different, but if you look at them, children, you're going to listen to children, you're going to listen to give birth to or have. Safe, donate blood. Is it safe to donate blood? Symptoms associated with the disease. She thought she might have the symptoms. So, again, here we have the script from the interview. So, the interviewer asks him to describe an individual case. So, he says, a Bolivian woman, let's call her Marisol, asked me if she could be tested for Chagas. She's a long-term US resident, but had been on vacation in Bolivia and at one point had felt unwell. So she was in Bolivia on holiday and felt unwell, but she's a US resident. So this often changes because of diet, living conditions, etc. The patient thought it was just the change in the environment that made her feel strange. So another thing we can see here is hearing from relatives that Chagas can be transmitted congenitally was what prompted Marisol to come to my clinic. She and her partner wanted to start a family and was scared that she might pass the parasite on. Tests showed that she did indeed have intermediate stage Chagas. So the three things that covers. Let's go back, just as a check. Health of any children she wants to give birth to. That was mentioned prominently. It was safe for her to give blood and symptoms associated with the disease. Sorry, wrong way. So symptoms associated with the disease, she'd been on holiday and she'd felt unwell, so she thought she might have the disease. But the thing that really tells you here is that what prompted Marisol to come to my clinic, she'd heard from relatives that it can be transmitted congenitally. It means from parents to children. So that was what prompted her to come to the clinic. So that clearly tells us that the reason is that it can go from parent to child. Congenitally means within the family, usually from parents to children. So that's what made her come. So that immediately tells us that we're talking about children. And then it's reinforced by the next part. She and her partner wanted to start a family, so they wanted to have children, and she was scared that she might pass the parasite on. So that's very clearly telling us that that's the answer. And again, remember, look at the other answers. Once you find what you think, well, this is the answer, always look at the other two to make sure that they are definitely not the answer. Don't just go to the first one. Oh, there's the answer, there's the information, and put it down as your answer, because what they do is they put things in there to trick you. That's the best word that I can use, to trick you. That's what they're trying to do, to see if you can see the difference in certain things. So always check the other two answers. Look at the references to the other two choices and see if they fit. If they don't fit, you know that the one that you've chosen is the correct answer. So again, here it just tells us what I've just mentioned about congenital transmission, prompted her to come to the clinic. She wanted to start a family. So all of those three things reference having children. So the answer is A. She was worried about the health of any children she might have. Okay, this video has two examples of questions. Because this is a tricky part of the test, you need to ensure that any unusual vocabulary you encounter is taken into consideration, as it is often placed there to give you clues. So the marginalised communities, the synonym there to give us the clue in green. There are always clues, but you have to be able to recognise them. This comes from a combination of practice, repetition, and increasing your all-round vocabulary with more relevance to synonyms, medical terms, and paraphrased statements or expressions. So learn synonyms, learn paraphrased statements, because a lot of this exam is about paraphrasing and synonyms. So my suggestion to you is make sure that you do practice looking at synonyms, writing them down. When you come across words, think to yourself, what other word could replace that and has the same meaning? Or when you see an expression, how else could that be explained? So for example, if you say she had come to the clinic to seek advice, you could say she visited us because she wanted to know something. Now those two sentences basically mean the same thing, so we could call them paraphrases. So this is very common in the exam throughout all four sections, so make sure that you practice this a lot. Please use the link below to download the video and use the material to practice the rest of the test. To receive answers to the test, please go to the website and open the envelope if we're not online. And you can request in the information field. So the email is admin@OET Medical. So just leave your email address, say what you want. Answers to Part C listening. Yes, answers to Part C listening. If we're online, we will chat directly to you. So we'll just answer your questions and we can send you immediately the information you need. Okay, that's the end of the lesson. And this video is going to go on our main site, but most of our new videos are going to be on a private site. So if you're enrolled with us and paying for your classes, whether that be online classes or writing, we do correspondence writing courses. So if you only want to write letters and have them checked, we also do that as a package. Please tell your friends, if you have any friends who want to study, please tell them to visit the website oetmedical.co.uk, or they can book classes directly on our booking site, which is booking@oetmedical.co.uk. And again, subscribe to the regular YouTube channel. If you decide to take classes with us, then we will give you the URL of the private channel. So the private channel is only for people who are taking lessons with us. So thank you for your time. I hope this video was useful. Part C takes a lot of practice, so don't get disheartened if you have difficulties at the beginning, because from my own personal experience as a teacher, it is difficult. It's very difficult because the texts are quite long and you have to practice sectioning them. So you're listening to certain things and you're keeping track of where you are on the audio. So it's difficult, but it can be done with practice and by using the techniques I've outlined in this video. Thank you, and see you in the next video.